The big story that we are watching, a state of national disaster has been declared. Let's get started with our coverage of South Africa's response to COVID-19, the virus. Cabinet ministers have outlined their plans to deal with the growing COVID-19 pandemic. President Cyril Ramaphosa has banned travel to various high-risk countries and banned gatherings of more than 100 people. The country has seen a sharp increase in the number of cases over the past week. ENCA's Govan Whittles joins me now from Pretoria, where a media briefing has been taking place for much of this morning. Govan, it was a lengthy media briefing with many ministers speaking, each one plugging in terms of their portfolio and how they will be contributing to the national response to what has been declared a national disaster by the president. What were the major takeouts for you?
Yeah, there's certainly a lot to get through, Thulasizwe, but I'll just go through some of the main ones, which relate more to how South Africa is bracing for the number of infections of COVID-19 to increase. So we saw the president announcing these measures for the countries which are high risk, including travel bans, a restriction of flow of persons to those countries. But what we got here today was really the response from the government to what's happening inside the country. So we know that the health minister is saying there's 61 cases of COVID-19. They're investigating 4 more suspected cases, but it's also interesting how they're planning to respond to it within society. So we know that there is about 20,000 hospital beds that are available to Thulasizwe. That's public sector and private sector, of which 1,000 of them are in the ICU. And more interestingly, we know that the banning of public gatherings of more than 100 people would be hard to enforce. I spoke to the Justice Minister, Ronald Lamola, who was saying that even though the National Disaster Management Act allows for gathering of up to 1,000 people, they're busy drafting the regulations that would limit that to 100 people. And once the cooperative governance minister has done that, it would be enforced by officials from her department as well as the police. But the big thing here is to what extent is the public at risk of catching coronavirus? And there's a massive campaign that's being prepared. Major testing stations will be set up across the country by the health department, and the transport minister says they want to disinfect taxi ranks, and they believe that they can conduct random screening at those taxi ranks. Of course, the infections could happen through local transmissions of COVID-19, and that's what the health minister has confirmed has been happening. We heard it from the president, but we got some more detail from Zweli Mkhize about the extent of the suspected local transmissions. Let's have a look at that now.
The other cases that someone asked about, what about these suspected local transmissions? Those are under investigation, and we will confirm them as soon as we have all the information. For example, one of them is a 3-year-old child, and who's a source, who's linked to a contact, but we're trying to establish the exact connection between them. So that's why we're not going to go into more details about it. But it looks like the parent was not unwell. The parent, it was the child that was unwell, so this one was tested. So we're trying to establish the link as to where that link is. That one is in KZN.
Yeah, that's the health minister, Zweli Mkhize, talking about the local transmission. I've focused mainly on the government's response to the pandemic and the outbreak, but of course there is a broader economic impact here. And I'm joined by my colleague Aviwe Mtila from the ANCA Money Desk. Aviwe, you've been looking at the government's response to the potential economic impact, as well as exactly where they're going to find the money to fight this coronavirus.
Well, certainly, Coven, and you'd find that the first point of entry where they're going to find the money is basically the National Disaster Fund, I beg your pardon. That's just one of the places, even though the Finance Minister didn't say how much, in fact, that they'll be getting from there, but that's just one. The other place that they'll have to find money from is the budget that we just heard last month. There's no avoiding, in fact, that they will be tweaking off the budget, in fact, to get money in for the response of the coronavirus. But the Finance Minister, in fact, did say that while South Africa faces this COVID-19, the economy cannot stop and, essentially be to a halt at the moment. But let's listen to what Tito Mboweni had to say on that.
Second issue we're faced in the financial sector is the market risk, which is arising from large reductions or falls in share prices right across the world, which actually in practice means that many people's wealth is being reduced as a result of market developments. People who hold bonds and shares and so on. And so Minister Patel and myself will be holding meetings with the leadership of the Johannesburg Stock Exchange to see what actions can be done. To see what can be done. I don't want to spook the market, but we'll be having discussions with them. Then you've got insurers. Insurers normally have exclusions from pandemics. And this is something that is to be discussed because they will say, for example, that insurance covers don't cater for things like conference cancellations, flight cancellations, and all kinds of exclusions. Now, I'm not saying that we're going to force them to stop the exclusions, but a conversation in a situation like this is necessary so that we're all working together. As far as the banks are concerned, banks, as you know, are critical to our economic system, both in deposit taking and lending. They provide mortgage bonds and other forms of financing. So a conversation needs to be had about what to do in the times of crisis. Let's assume a number of workers are unable to go to work for one reason or the other, but they have a bond with a bank. What does that mean? It's a conversation to be had, not to force ourselves on them, but to say let's have a conversation about all those things. So I think that kind of conversation is necessary. I suppose our primary objective at this moment is that the economy does not grind to a halt. It must continue to operate.
The economy cannot grind to the halt. Finance Minister Tito Mboweni, one of the people inside are giving those tables. You understand, get a sense that, in fact, the economy is the key priority. We heard that from the Home Affairs Minister, basically saying that all ports of entry have nothing to do with commerce. But we do understand a detailed plan on how to, in fact, mitigate the impact of the economy will be tabled at a NEDLAC meeting that's currently underway this very moment. Govan.
Thank you so much. Aviwe Mtila, the ENCA Money Desk. Of course, there are many moving parts here, Thulasizwe, and over the next coming days we expect to get more detail from this command center and council that's been set up, particularly to how they're going to respond directly to South Africans. That's the detail that's missing at the moment. What can South Africans expect when they get to the areas where they usually congregate and there are a lot of people, taxi ranks, train stations and so on. But we are expecting another briefing or at least update through the Health Minister later in the week. For now, it's back to you.
All right, Govan, Aviwe, thank you so much joining us from Pretoria. They're giving us an update. It's an evolving situation and you can count on our teams on the ground to help you make sense of it all.